Prediabetes is a condition that occurs when blood sugar levels are elevated but do not reach the threshold to be diagnosed as type 2 diabetes. It is a crucial stage in which steps can be taken to reverse the progression to full-blown diabetes. An important part of this awareness is recognizing early symptoms that may indicate the presence of prediabetes. The following are the top 5 symptoms you need to be aware of. 1. Excessive thirst, a warning sign for prediabetes. Excessive thirst, also known as polydipsia, is a symptom that can be an important indicator of prediabetes. It is often one of the first and most notable warning signs of an underlying problem with blood sugar regulation. While it's normal to feel increased thirst on hot days or after intense physical activity, persistent, unexplained thirst over time can be a red flag. Understanding why excessive thirst occurs in prediabetes is essential. This symptom derives from the body's difficulty in processing sugar, or glucose, properly. In individuals with prediabetes, the pancreas still produces insulin, but the body's cells become less responsive to its effects. This condition is known as insulin resistance. As a result of insulin resistance, glucose from the food you eat cannot efficiently enter your cells to provide energy. Instead, it builds up in the bloodstream, resulting in high blood sugar levels. The body tries to eliminate excess glucose through urine, a process that involves removing water from the body's tissues. This results in an increase in urinary frequency, known as polyuria. The combination of increased urinary frequency and the body's efforts to eliminate excess sugar creates a cycle of dehydration, triggering feelings of extreme thirst. The body is trying to replace lost fluids, leading to an uncontrollable desire to drink water. Recognizing excessive thirst as a possible sign of prediabetes is critical because it offers the opportunity for early intervention. Prediabetes is a stage in which the progression to type 2 diabetes can be stopped or reversed through lifestyle changes such as diet and exercise. By addressing the underlying cause of insulin resistance, it is possible to restore the body's ability to effectively regulate blood sugar levels. 2. Excessive hunger and prediabetes. Understanding the relationship. The feeling of hunger is a natural response from our body when blood glucose, sugar, levels begin to decrease after a period without food. However, feeling insatiable hunger right after a meal can be a warning sign, especially when it comes to prediabetes, a metabolic condition that precedes the development of type 2 diabetes. To understand why excessive hunger may be related to prediabetes, it is necessary to understand the role of glucose in controlling hunger. Glucose is the main source of energy for cells in our body, including the brain. When we eat, food is digested and converted into glucose, which is released into the bloodstream. In this process, the pancreas plays a crucial role by producing insulin, a hormone that allows glucose to enter cells to be used for energy. In people with prediabetes, cells become resistant to the action of insulin, which means that glucose cannot enter cells effectively. As a result, cells do not receive the necessary amount of glucose to function properly. When cells do not receive the glucose they need due to insulin resistance, the body perceives this shortage as hunger. Even though we have just eaten, our cells are still lacking energy, which triggers the feeling of persistent and intense hunger. This hunger can be especially noticeable after meals high in carbohydrates, which convert to glucose at a faster rate. Additionally, prediabetes is also associated with fluctuations in blood sugar levels, with spikes and drops that can lead to feelings of hunger shortly after eating. These fluctuations occur due to the body's inability to regulate glucose efficiently. Excessive hunger after meals should not be ignored as it could be a sign of prediabetes. It is important to seek medical advice and perform fasting glucose tests and other diabetes-related tests to confirm the diagnosis. Early detection of prediabetes is crucial as it offers the opportunity to implement lifestyle changes, such as adopting a balanced diet and exercising regularly, which can help reverse insulin resistance and prevent the development of prediabetes. Type 2 diabetes. 3. Fatigue and blood sugar levels, an important connection. Chronic fatigue is a symptom that affects the quality of life of many people around the world. It's a feeling of persistent exhaustion, often accompanied by a general lack of energy and motivation. What many don't realize is that chronic fatigue can be related to unbalanced blood sugar levels, in particular the condition known as prediabetes or type 2 diabetes. To understand this connection, it is essential to understand how glucose, or blood sugar, works as a source of energy for the body. When we eat, our bodies turn carbohydrates into glucose, which is then transported to cells to be used as fuel. Insulin, a hormone produced by the pancreas, plays a crucial role in this process, allowing glucose to enter cells. In people with prediabetes or type 2 diabetes, an imbalance in this system occurs. Insulin resistance is a common feature of these conditions. This means that cells do not respond adequately to insulin, making it difficult for glucose to enter. Consequently, the body does not receive the necessary amount of glucose to meet energy demands. Chronic fatigue is a common symptom in this scenario. When cells don't have enough access to glucose, the body perceives this as a shortage of energy. This feeling of persistent lack of energy can manifest as constant tiredness, difficulty concentrating, and a general feeling of weakness. It is crucial to recognize that chronic fatigue should not be ignored, as it can be a warning sign of health problems such as prediabetes or type 2 diabetes. Early diagnosis of these conditions is essential, as it allows measures to be implemented to control blood sugar levels. Lifestyle changes, including eating a balanced diet and exercising regularly, can help improve insulin sensitivity and balance blood glucose levels. Furthermore, in some cases, it may be necessary to use medications prescribed by your doctor. 4. Blurred vision and high blood sugar, a crucial link. Blurred vision is a symptom that can be closely related to high blood sugar levels, especially in people with diabetes or prediabetes. Understanding how this occurs involves an understanding of the effects of high blood sugar on the lenses of the eyes. The lenses of the eyes are responsible for focusing the light that enters the eye, allowing us to see clearly. To function properly, lenses need to maintain a specific shape and size. Glucose, which is the main source of energy for the body, is also essential for the eyes, but only when maintained at balanced levels. When blood sugar levels are persistently high, as occurs in uncontrolled diabetes, excess blood glucose can affect the lenses of the eyes in several ways. Firstly, excess glucose can cause fluid to build up in the lenses, resulting in swelling. This changes the shape of the lens and, consequently, its ability to focus light properly. The result is blurred vision, which may be intermittent depending on how blood sugar levels fluctuate throughout the day. Additionally, high blood sugar can affect the blood vessels that supply the eyes. This can lead to a number of eye complications, such as diabetic retinopathy, which can also cause blurred vision and other vision problems. Controlling blood sugar levels is essential to preventing and managing these vision problems. People with diabetes are advised to maintain close control of their blood glucose levels through diet, exercise, and, in some cases, prescribed medication. This helps prevent blood sugar fluctuations that can cause blurred vision and other eye complications. If you experience blurred vision, especially if it is a frequent symptom, it is crucial to see an ophthalmologist and a doctor who specializes in diabetes. They can assess your eye health and blood sugar levels, offering appropriate guidance and treatment if necessary. 5. Unintentional weight loss. Unintentional weight loss is a phenomenon in which a person loses weight without making conscious efforts to lose weight, such as following a strict diet or exercising intensely. This symptom may be an indication that the body is not processing glucose efficiently, often related to problems with carbohydrate metabolism. One of the main scenarios in which this occurs is insulin resistance, a common component of prediabetes and type 2 diabetes. Insulin is a hormone that allows cells to absorb glucose from the blood to use for energy. When cells become insulin resistant, the body needs to produce more insulin to maintain normal blood glucose levels. This imbalance can lead to several metabolic changes. First, the body cannot utilize glucose properly, resulting in a lack of energy in the cells. This can lead to a feeling of weakness and fatigue, as well as encouraging the body to burn its fat and even muscle reserves for energy. As a result, a person may lose weight unintentionally. Additionally, insulin resistance can increase appetite, leading to greater food intake, which may seem contradictory to weight loss. However, the increase in appetite is not accompanied by an increase in glucose absorption by cells, resulting in a cycle of calorie intake without proper use, which contributes to weight loss. Therefore, unintentional weight loss, when associated with inefficient glucose processing, can be an early sign of metabolic problems such as prediabetes or type 2 diabetes. It is crucial that any unexplained weight loss is evaluated by a professional healthcare team to investigate the underlying cause, properly diagnose and manage these conditions, and thus preserve the individual's overall health. In closing, we would like to reinforce that this video is purely informative, intended to raise awareness of the topics discussed. If you or someone you know is experiencing any of the symptoms mentioned, it is essential to seek guidance from a healthcare professional. Only a professional can perform a proper assessment, diagnose any underlying condition, and provide appropriate treatment. Your health is valuable, and taking early action can make all the difference. Thank you very much for watching this video. If you found this content informative and valuable, Please share it with others who could benefit from this information. Sharing knowledge is a powerful way to help disseminate important information and reach a wider audience. Stay tuned for the next video that will appear on your screen, as we will continue to bring you relevant and educational content. See you soon!